The work I'm doing today will save lives for the next 50 years. Here's how to build a healthcare legacy that outlasts your career. Years ago, I had a moment that completely changed how I thought about my career in healthcare. I was working as a registry nurse, and I just finished what felt like the 1,000th shift of my life. As I walked to my car, I started doing the math in my head. If I worked for another 30 years, helping maybe 15 patients per shift, 4 shifts per week, I'd directly care for about 93,000, 94,000 patients in my entire career. That's a lot of lives touched. But then I asked myself a question that changed everything. What if my impact could continue long after I retire? What if the work I do today could help patients for decades to come? Here's the hard truth about traditional clinical careers. Your impact ends when your career ends. When you retire from bedside nursing or clinical practice, all that expertise, all those years of pattern recognition, all that clinical wisdom, it walks out the door with you. The next generation has to start from scratch, learning the same lessons you already mastered. But what if there was a way to capture your clinical expertise and make it permanent? What if your best clinical judgment could continue helping patients long after you've moved on? That's exactly what's happening in digital health. And most clinical professionals don't even know about it. Let me tell you about the work I'm doing now and how it will outlast my career by decades. I work as a digital health consultant, helping healthcare technology companies build decision support systems, among many other things. But here's what makes this different from traditional clinical work. I'm not just helping individual patients. I'm embedding my clinical expertise into systems that will help patients for generations. I helped design an early warning system for sepsis detection. The system takes the pattern recognition I developed over 15 years of nursing and turns it into an algorithm that monitors patients 24/7. Here's the legacy part. That system will continue identifying sepsis risks and saving lives decades after I retire. My clinical intuition, captured in code, becomes a permanent part of how healthcare works. Let me walk you through what 50-year healthcare legacy actually looks like, because this is bigger than most people realize. Years 1 to 5, the systems I helped design get implemented in hundreds of hospitals. My clinical expertise starts helping thousands of patients annually. Years 6 through 15, these systems prove their value and get adopted by major healthcare networks. Now I'm indirectly helping hundreds of thousands of patients through better care protocols. 16 to 30, the clinical insights I contributed become standard practice. Schools start teaching the care protocols that included my expertise. New generations of healthcare workers learn from systems I helped create. Years 31 to 50, my clinical knowledge has become so embedded in healthcare delivery that it's just how things are done. Millions of patients receive better care because of the systems that started with my nursing experience. This isn't science fiction. This is exactly how medical knowledge advances and becomes permanent. Let me give you some concrete examples of healthcare legacies being built right now by clinical professionals. Sarah, an ICU nurse from Chicago, helped develop an expert system that's now preventing sepsis deaths in over 300 hospitals. Her clinical pattern recognition skills are permanently embedded in technology that will save lives for decades. Dr. Martinez's rural care legacy. A family physician who worked in rural Texas helped create telemedicine protocols that bring specialist care to remote areas. His clinical guidelines now help thousands of rural patients access expert care they could never reach before. Maria's physical therapy legacy. A physical therapist who specialized in stroke recovery helped design AI-guided rehabilitation programs. Her expertise now helps stroke patients worldwide recover faster and more completely. These aren't just career changes, they're legacy projects that will continue improving patient care long after these professionals retire. Let's talk about the real numbers, because the difference between traditional clinical impact and digital health legacy is staggering. The traditional clinical career impact is 15 patients per shift, 4 shifts per week, 50 weeks a year, times 30 years, that's 90,000 patients or so, help directly. Impact ends when the career ends. Knowledge is lost when clinician retires. The digital health legacy impact. Systems help design reach 100,000 plus patients annually. Impact continues and grows for 50 plus years after career clinical expertise becomes permanent. Digital health legacy impact. Systems help design reach 100,000 patients annually. Impact continues and grows for 50 plus years after the career. Clinical expertise becomes permanent and part of healthcare. We're talking about the difference between helping 90,000 patients versus helping millions of patients. The difference between 30 years of impact versus 50 plus years of continuing impact. But this isn't just about numbers. It's about the kind of work that gives you energy instead of draining it. When I was doing registry nursing, I'd come home exhausted, both physically and emotionally. I was helping people, but I was also fighting broken systems, dealing with understaffing, and watching the same preventable problems happen over and over. Now, I wake up excited about work because I'm actually fixing the problems that used to frustrate me. Instead of working around broken systems, I'm building better systems. Instead of treating the same preventable complications repeatedly, I'm helping design systems that prevent those complications from happening in the first place. So if you're sitting there thinking, I want to build that kind of legacy, here's how you start thinking about it. First, identify what you're really good at clinically. What patterns do you recognize faster than others? What problems do you solve that keep coming back? What expertise have you developed that could benefit thousands of patients if it were scaled? Second, start looking for digital health companies that are trying to solve those exact same problems. They need your clinical expertise to make their technology actually work in real healthcare settings. Third, position yourself not as someone who wants to learn technology, but as someone who has the clinical knowledge that makes technology successful. You're not trying to become a programmer. You're trying to become a clinical expert who guides programmers. Last time I attended Oracle's in-person client event, I saw my pressure ulcer prevention protocol on display for other hospitals to copy and reuse. It's now proven to prevent skin breakdown and is standard for hospitals using that system to drive down pressure ulcer rates at thousands of hospitals. The patients admitted at those hospitals won't have to stick around to resolve a new decubitus ulcer. They'll go home and spend their time with their family. Same thing goes for the ECMO documentation for those terribly sick, mostly sickle cell patients. That's what 50-year legacy looks like. Your best clinical judgment permanently embedded in systems that continue saving lives long after you've moved on to other things. Here's why this matters now more than ever. Healthcare is going through the biggest transformation in history. AI, automation, robotics, digital health, all of this technology is reshaping how care gets delivered. The clinical professionals who get involved in shaping this transformation now will be the ones whose expertise becomes permanently embedded in how healthcare works for the next 50 years. But if clinical professionals stay on the sidelines, these systems will be built by engineers who've never provided patient care. And we'll end up with brilliant technology that doesn't work in real life. Your clinical expertise isn't just valuable. It's essential for building healthcare systems that actually serve patients and providers. Your legacy starts today. If you're ready to start building a healthcare legacy that outlasts your career, you don't have to figure this out alone. I've created a comprehensive guide that shows you exactly how to transition from traditional clinical work to digital health legacy building. It includes real examples of clinical professionals building 50-year legacies, the specific companies that are hiring clinical expertise for digital health roles, how to position your clinical knowledge as the foundation for a lasting impact. The legacy steps I took to go from registry nursing to AI consulting and digital health. Comment legacy below, and I'll send you the complete guide. Also, make sure you subscribe because I share new opportunities for clinical professionals to build lasting impact every week. The healthcare systems of 2075 are being designed today. The question isn't whether technology will transform healthcare. It's whether clinical professionals like you will be part of shaping that transformation. Your greatest contribution to healthcare might not be the patients you care for directly. It might be the millions of patients who receive better care because of the systems you help create today. Are you ready to build a healthcare legacy that saves lives for the next 50 years?